Hello, assalamu alaikum. This is me, Dr. Jangir, and you're watching me on my YouTube channel. So this X-ray was uploaded by me in the group, and there were different answers. So today I'm going to discuss this X-ray. Now there are a variety of differential diagnoses of this X-ray. First, we discuss the finding. So you here see a rounded opacity in the mid to lower zone of the right lung, and you can see the blunting of the gastrochronic angle, and there is opacification in the lower zone, homogeneous opacification, and you can see this opacification goes up in the periphery. So you are having opacity with opacification and blunting of the angle. So the first differential that would come in your mind is number one, the CL lung. Yes, CL lung. If this patient is an aged patient, let's for example say more than 50 years of age, and he is having hemoptysis or signs and symptoms suggestive of malignancy, or the patient is having a diagnosed case of cancer somewhere elsewhere in the body, then the first differential will be CL lung, because there is opacity with effusion. So CL lung, either primary or secondary. The second differential here would be pulmonary embolism. Yes, pulmonary embolism. You are having this opacity with effusion because X-ray is a two-dimensional view of the three-dimensional structures. So maybe this is a infarction. You can say this is a Hampton's hump in the posterior of the chest that looks like lying in between or lying interior of the chest on the chest X-ray. So you cannot say confidently where is it location. You cannot comment on the location of this opacity. Maybe this is in the periphery, either anteriorly or posteriorly, and not in the middle, and this is Hampton's hump. Let's for example say the CTP or the CT will further guide you. But opacity with effusion, the next differential will be pulmonary embolism. But again, it depends upon the history and examination. If for example say this person is immobile, or the patient is having a DVT and no alternative cause, then this is another differential. Now the third differential in this case would be if a patient is having opacity and he's having effusion on this side, the third differential will be pseudotumor. Yes, pseudotumor. This can be cardiac failure, and this is opacity. This is the fluid in the fissures. Whenever there is a fluid in the horizontal fissure, it looks like that. So effusion with opacity in the horizontal fissure. So you should think of transudatio collection of the fluid. Yes, this should be the third differential. Now, what can be the cause of this? Cardiac failure, kidney failure, liver failure, malabsorption. So all these can cause fluid in the fissure and effusion. Hepatic hydrothorax is another differential. Now one can say this is a unilateral. How can you say yes? But you see, in minority of cases, I would not say majority, in minority of the cases, especially on the right side, the fluid can be transudative. Yes, and it depends upon the location of the patient. If the patient lies in the bed on the right side most of the time, then yes, he can have fluid collection on the right side that may be transudative. So these are the close three differential: opacity with effusion. So CL lung, second is pulmonary embolism, and the third is this one, the transudative effusion, fluid collection in the space. Well, the fourth differential can be lymphangitis carcinomatosis. That's again a malignancy, that is a lymphatic spread of malignancy. So that's all for today. Thanks for watching.